the coccyx, the parts of the innominate bone, then the parts or the areas in the sacrum, and then the coccyx we have studied right yesterday. And then I have left with definition and meaning of the true pelvis and then the false pelvis. So now let's see the true pelvis. Okay. So can you all see this? The pelvic bone? Is it visible?
Yes, ma'am.
Okay. So you can see the slide. Slide also you can see now, or you can see only the picture. Can you see the slides?
Yes, ma'am.
Is the slide visible? Okay, so this is the pelvic bone. Okay, the pelvic bone. So here, when we are talking about the true pelvis, okay, I have talked about this thing, right? The round thing, the brim. Okay, the brim we have talked about. So in this brim, okay, here we have in this true pelvis. Yesterday we have talked about the brim, the cavity, and then the outlet. Okay, the outlet. Okay. So here, we will now talk about the pelvic brim. So in pelvic brim, you know the areas, the landmarks. Have you heard? What are the landmarks?
Yes, ma'am.
So can you name any landmark? Can you name me the landmarks?
Scale spine and sacral promontory.
Am I audible? Class? Okay, so let's.
Yes, ma'am.
Okay, so let's see here. Okay, in the pelvic brim we have the sacral promontory. Okay, this is the sacral promontory. Can you see it? This bony prominence is the sacral promontory. Okay, and then this area. Okay, the area from the sacral promontory till the sacroiliac joint, the area that stretches. This is known as sacral ala or the wing. Okay, sacral ala or the wings of the sacrum. Okay, that is the second part. That is the second landmark. The third landmark is the sacroiliac joint. This joint, the joint that the ilium, okay, and then the sacrum. Okay, there is a connecting joint here. There will be this is a joint. So this is the third landmark, and then we have the in the landmark again. Okay, in this brim we have the the iliopectineal line. This line. Okay, the iliopectineal line. In both sides you will have the iliopectineal line. Okay, in both the innominate bone. Then we will come to iliopectineal eminence. You will see a bony protrusion in the when you feel it. Okay, when you feel it, you will feel a bony protrusion. Okay, that is the iliopectineal eminence. Okay, then we will come to the pubic. Then the the pectineal line. Okay, this is the pectineal line. Okay, the pectineal line. After that, we'll go to the pubic tubercle. Okay, you will feel a bony protrusion here again, the pubic tubercle, and then the pubic crest. Okay, then you will find the symphysis pubis, and then the superior and inferior ramus of the pubic bone. So these are the landmarks of the in the brain. Okay. So as I've already stated yesterday, I've given you a brief introduction about the true pelvis, it consists of the brim, the cavity, and then the outlet. So in the brim, those are the 9 landmarks. All right. Now coming to the diameter of the brim. Have you heard about the diameters? Diameters of the brim, the cavity, the outlet. You have heard, right? So the diameter. Let's see the anterior posterior diameter. Okay, so here in the diameter of the brim, okay, the anterior posterior diameter, it stretches from the sacral promontory, okay, the sacral promontory to the upper inner border of the symphysis prepuce. So it will stretch from here till the upper inner border of the symphysis prepuce. Okay, so it measures 11 centimeter. All right. Now let's see the oblique diameter. So in the oblique diameter, it will be in oblique. Okay. So here, in the oblique, here you will have the right and then the left oblique diameter. Okay, it stretches from the sacroiliac joint. Okay, it stretches from the sacroiliac joint to the iliopubic eminence. Okay, the eminence here. Okay, it stretches from here. So it will be 12 centimeter. And then now let's see the transverse diameter. It is the two farthest point between the two iliopectineal line. Okay, the two farthest point of the iliopectineal line. Okay, so this, it will be the transverse. This one, it measures 13. Okay, so you can remember it as 11, 12, and 13. Okay, those are the diameters in the brim. Now coming to the pelvic cavity, this cavity, okay, that lies below the brim. Okay, so it extends from just below the brim and then up to the outlet below. Okay, so this area is this area. Okay, this is the cavity. So it is circular in shape. Okay, and then as it is circular in shape, we are considering it as all the diameters. Okay, whether it is an anterior, posterior, oblique, or transverse, it measures 12 centimeter each. Okay. Now coming to the pelvic outlet, that is the outlet. Okay, this is the outlet. This area is the outlet. So in this, we have the anatomical as well as the obstetrical outlet. So in anatomical outlet, it is formed by the lower borders of each bone. Okay, lower borders of each bone with the